This is Spotlight on 760 WJR. Tonight, executive plastic surgery with Dr. Khan. Now here's your host, Marie Osborne.
And welcome. Our pleasure to welcome to WJR Dr. Shaher Khan, a world-renowned breast implant specialist and plastic surgeon with executive plastic surgery in Bloomfield Hills. We're so glad you're here, Dr. Khan, to answer some very important questions about this topic. But first, why don't you tell our listeners a little bit about yourself?
No, thank you very much for introducing me. It's a pleasure and an honor and a privilege to talk to you. And it's a privilege to have met you in person. And so this is a very important topic. As you will see, a little bit about myself. I am Shaher Khan, Shaher W. Khan. I'm a board-certified plastic surgeon. I'm also a board-certified general surgeon. I also did train and did my critical care and burns training as well, a total of 10 years post-medical school. So I have done, in my initial part of the training, mastectomies, along with a lot of reconstruction of the chest, for example, gunshot wounds, trauma, patients, thoracic surgery, many different facets that made me board certified in general surgery. Following that, I did my 3 years of plastic surgery training, and I'm honored to have trained under very world-renowned plastic surgeons as well.
It is a pleasure to have you on board here at WJR. There are so many questions about breast implant disease. We hope to talk a little bit more about that and your role in helping women to deal with this very important health issue. You're listening to WJR. Dr. Shaher Khan joining us from Executive Plastic Surgery. We'll be right back. We're back with Dr. Shaher Khan, Executive Plastic Surgery in Bloomfield Hills. Dr. Khan, before we get into the entire issue about breast implant illness, which you are an expert in, let's talk about how big the problem is. How many women have breast implants? Who are the women that are ultimately going to be faced with the decision to take those implants out? But let's talk about the numbers for a moment.
So the jewel of plastic surgery is breast augmentation. This is where it is the most common surgical procedure done by plastic surgeons. It's an hour-long surgery where majority of the patients who end up getting it for cosmetic reasons get this surgery done where the implant is placed underneath the muscle. Now, when these patients get their implants, they basically need to be aware as far as what are the long-term consequences of the implants themselves. And so going back to the issue, the first thing is you will hear the FDA and the manufacturers themselves say that these are not lifetime devices. So when you hear someone say that these implants will last me a lifetime or they will be with me forever, that is incorrect information. Clearly, as highlighted by the FDA and the manufacturers, as stated earlier, they last in the body 10, 15 years. And this is where, as you will see, the studies that have been done, they track and evaluate the implants for 10 years, 12 years, and following that basically there are no more studies because the implants basically will result in problems. So as I will read, quote, warning, breast implants are not considered lifetime devices, period. The longer people have them, comma, the greater the chances are that they will develop complications, some of which will require more surgery, period. So this automatically means that some patients may get a rupture, they may get a secondary infection, they may get capsular contracture, they may have fluid. Very small subset of patients, very rare, but they do get what is the breast implant associated anaplastic large cell lymphoma. They can get malpositioning. They can get the acute and chronic pain. They may have fluid that may develop around. Sometimes they may basically affect the patient in a negative way where they may not be comfortable getting a mammogram, and now breast cancer screening may not be done optimally, or the patient may delay getting a mammogram or any imaging, and a mass may be missed because the mass was behind or in the proximity of the implant that was basically getting in the way of a good self-monthly breast exam. So ultimately, the implants all eventually will need to be replaced or at least removed. And as you will see, we have right now history essentially repeating itself, which means that you have a lot of patients now coming forth with their set of problems ever since the implants were reintroduced into the market in 2007. they now are getting of age, i.e. the implants. And now you're starting to see the patients that are coming in with what are ruptures, pain, problems, now that they're starting to occur 10, 12, 15 years out since they were reintroduced into the market. So the patients need to understand that if they have these problems, that there is a very defined way of taking care of this so that you address the problem definitively and you don't have to hurt this and suffer as you have to deal status post replacement or a explant.
A couple of quick questions I want to go back on. The issue of the mammogram, because you said sometimes mammograms by nature can be uncomfortable for some women. If you have an implant that's uncomfortable, then you add that to the equation. So you're saying that some women avoid getting mammograms, which is a whole problem in and of itself when they have implants. Can cancer still be detected if you have an implant?
Absolutely. It is done every single day. So there are defined views, the Eklund views, Eklund views, which are modified views for those ladies that have implants. They can go to a imaging facility, and they should be and will be able to do these modified defined views so that they can get better views of the breast tissue, especially those ladies that have implants. Remember, the most common way of picking up breast cancer is a self-monthly breast exam. Following that, right up there is the mammography. And then depending on what is done, ultrasounds can be done, and maybe depending on the breast center workup and MRI as indicated, if indicated. We need to look at the hard fact that 1 out of 8 or 9 women will get breast cancer. And so it is important to be able to effectively screen for breast cancer so that it is picked up early, and that some patients who have suspicious lesions get the biopsy that they need. I hear so many times ladies who have lesions right in the proximity of the saline or silicone implant, and now the doctor, the interventional radiologist, is not comfortable doing a biopsy simply because they feel that they might hurt the implant. So there are many factors that one has to take into consideration where if you have an implant, certainly you should get your mammogram. That's the screening mammogram. You can then get a diagnostic or supplemented with an ultrasound as indicated. But what is worse, to deal with cancer or to deal with a ruptured implant? And I will state this, there are millions of ladies who have had mammograms who did not have a rupture or problems with getting a mammogram. So that is not a good reason to basically miss out on a mammogram.
Let's go talk a little bit about, because you mentioned that the large portion of people who may have implants, they're now coming due to be replaced or taken out. Have breast implants become safer? Have the implants themselves become safer, or are they still about the same?
So this is a very good question. So the implants were banned in 1992 to 2007, and they were reintroduced into the market as the gummy bear, safer, better, cohesive gel implants. You hear about some doctors driving their Ford F-150 truck over them and saying it's not ruptured. Now, if you join me on my Facebook group page, the private page or the public or the YouTube channel, you will see patient after patient, they are presenting with ruptured implants. And there is nothing gummy bear about them. There is nothing cohesive about them. They are literally melting like they were in the early 90s and the 80s that led to their ban. So we have the same problem essentially representing it itself 20 years, 25 years later. And this is where the gummy bear of implant is certainly gummy when it's put in, but over time, when it's incubated at 98.5 degrees and with the added trauma daily from the patient's movements, tasks, whatnot else, this certainly does compromise the integrity of the silicone and cause the implant to rupture. And one thing I may mention, that it is not necessarily the rupture in itself which is going to hurt. There are patients that react to the implants from day one. So just this morning, I saw a patient in my clinic that came to me from New York. She has implants just 4 years old, and very soon, right after getting her implant, she started to feel the hurt and her body started reacting. So you have this subset of patients. And another very important point I want to mention here is that even though the patient has the same intact saline implant, same intact silicone implant, or a ruptured implant, these three subcategories of patients present in a similar fashion, which means that a patient that has all the symptoms of breast implant illness that they may have an intact saline implant and they still present in a similar fashion as someone who has a ruptured implant. Now, believe it or not, many patients who have ruptured implants, they do not know that they even have a ruptured implant. And, we'll talk about this shortly, which means that they have what is a silent rupture. Their physical exam, their symptoms are not consistent with what is a rupture, and the patient has an unremarkable normal physical exam, and you would think she would at least present in a certain way, but she has the many symptoms that are potentially masked, or she may have no symptoms, and the implant certainly is ruptured and present in her body.
We're going to be talking a lot more about how you get a diagnosis of breast implant illness in our next segment. But I also want to remind our listeners today that Dr. Khan can be found on YouTube. You have an extensive array of videos on YouTube that people can view, and you specifically answer questions from patients on YouTube. Also, you have a Facebook page. There are TikTok videos. You are really pioneer in educating women about this particular illness. So we just want to make sure that all of our listeners know that you can contact or see Dr. Khan, Dr. Shaher Khan of Executive Plastic Surgery on YouTube, and that would be just searching Dr. Khan, Khan?
Yes. So if you go online and you just basically type in Dr. Khan, an explant expert, you will be able to pick me up on these many different social media channels.
And it's really worth watching because there's so much information that's being imparted on those. Of course, we're going to be giving you an awful lot of information on these shows as well. But when we come back, how do you get a diagnosis for breast implant illness? We're talking with Dr. Shaher Khan, Executive Plastic Surgery from Bloomfield Hills. We'll be right back.
You're listening to a special edition of Spotlight, Executive Plastic Surgery with Dr. Khan. Once again, here's your host, Marie Osborne.
Welcome back. It's Marie Osborne with Dr. Shaher Khan, Executive Plastic Surgery, talking about breast implant illness. Dr. Khan is a world-renowned expert in this field, and he's here today to talk to us about this problem of breast implant illness. Dr. Khan, can you tell our listeners how one goes about getting a diagnosis for breast implant illness? Maybe there's a woman listening or someone listening that knows a woman who's just not feeling right about her breast implant, that there's something might be wrong. I would think the first person you would go to would be your GP, but maybe that's not the first choice. What do people need to do?
So this is very important. You have to first define the problem, and then once you have defined it, then we have to tackle and deal with it. So there is no imaging test, there is no MRI, CT scan, ultrasound, mammogram that's going to diagnose it. There is no lab workup as well, no inflammation markers like CRP, ESR that are going to pick up on what is a diagnosis of breast implant illness. It is essentially a diagnosis of exclusion, which basically what that means is that you have the 14 different organ systems of the body that are affected. So one way to answer the question is, what is breast implant illness? So breast implant illness is a constellation of signs and symptoms that the patient presents with, both young and old, with the many symptoms, and I'm going to go head down, where you have hair loss, migraines, headaches, lightheadedness, ringing in the ears, you have vertigo, you have psych changes, anxiety, depression, you have mood swings, emotional instability, suicidal ideations in a select few of patients. Very rare, it does occur. You have patients with endocrine problems, thyroid problems, chest pain, shortness of breath, palpitations of the heart, neck, back pain, fibromyalgia, issues. You have rheumatological joint problems, which are the hallmark features of what is breast implant illness. You have patients, the most common symptom is fatigue. Even after a 8-10 hour sleep, they will still be very tired. Brain fog, they will forget what they were talking about or what they were planning on doing the next minute. You have patients that complain of GI disturbances, irritable bowel syndrome. They will have problems such as plantar fasciitis, so it affects almost all organ systems of the body, including the reproductive, if you will, as well, where the cycles, for example, the patients have premature menopause. So you have all these 14 different organ systems, some more, some less. Now, if you have a young lady, 25, or a lady in her middle ages, or even a 75-year-old lady that came to me and she said, well, I have brain fog. Everyone in her family said, guess what? You're 75. You are supposed to have some dementia. She said, I know myself better. How many 65-year-old patients? And this is where deep down within, the primary doctor is looking at the patients and saying, well, all the numbers look good, all the imaging looks good. I do not know what you're talking about. Why don't you go see a psychiatrist? Because this is the stresses of life. And you have the patients who have gone to the rheumatologist, endocrinologist, allergy immunologist, cardiologist, all the specialty of internal medicine. And all of the answers are, everything is fine. You don't have any major medical issues, and unfortunately, breast implant illness is not even considered. And this is where, if you see a young lady, and in my practice, what I have the ladies do is check off boxes from fatigue, brain fog, low libido, for example, autoimmune issues, and now a young lady with normal thyroid, no anemia, no symptoms that may be justifiable by, for example, someone who has hypothyroidism. You have to go correct that before you proceed with the surgery. You have to have patients that need to be worked up by the primary care doctor, so there is no underlying physiologic organic cause. Now, once all of that is negative and the patient has all these symptoms, we know going into the surgery that this is BII. I never tell my patients 100% you have a diagnosis. Now, only after the surgery, when the entire implant, capsule, and all of that inflamed tissue is removed completely, sincerely, definitively, you then hear the patients bounce back and then themselves state the benefits of having had an explant, and you will see the patients complaining initially before the surgery of the joint pain and how that has resolved, how their palpitations, for example, have improved, their migraines have improved, and you will hear the patients themselves. And not only that, you will see their pictures before and after that in itself will speak for itself. Now, going back to the FDA warning and the manufacturer's warning, I'm going to go ahead and read something over here. This is from the Mentor advertisement itself, and I'm going to quote. Patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Period. Individual patient risk for developing these symptoms has not been well established. Period. Some patients report complete resolution of symptoms when the implants are removed without replacement. Period. Close quotes. So as you will see, let's learn and dissect this. Now remember, all what I have said today is not my opinion. I'm just highlighting what the FDA has said, what the manufacturers are seeing, and most importantly, what the patients are seeing in the masses now that they're using the social media to echo what they did when they said in the 80s that led to the ban. So looking at this last paragraph that I read verbatim, it says that breast implant illness does exist. This is the joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others, right? These are the symptoms that is the breast implant illness. So first thing, we have to acknowledge the fact that it does exist. You hear a lot of doctors say, well, it does not exist. And unfortunately, that is wrong information. It does exist. And then they tell you, they report, quote, complete resolution. And this is where you have relief. So if you have a defined problem and you have complete relief, and this is what they're telling you, then you know this is the relief. Because The other two things that end up happening to the patients are what? If they don't get an explant, they live like so and in misery, thinking that that's their postmenopause state. This is the part of getting old. This is who and what I'm supposed to be. And they do not know any better, because remember, these are very subtle, i.e., but very defined problems. The second thing is these patients unfortunately get put on prednisone steroids or basically rejection medications, transplant medications, in order to suppress the immune system. Because in a nutshell, what is breast implant illness? It's the body reacting to the implants in a negative way as a foreign body, and the body is trying to fight this system, i.e., the silicone, that is basically hurting and harming the body. And now, as a result, it goes on overdrive, and you have these autoimmune phenomenon, these joint, neck, back pain, which are the hallmark features, and the body is trying to defend itself. And we know this very clearly from the pathology. That's the capsules that I sent to pathology, and the pathologist reads foreign body giant cell reaction, non-polarizable material, histocytic reaction, chronic inflammation, and this is the body trying to fight off the implants. And we know this from the histology because that is exact objective evidence, and we see this echo not only objectively but also subjectively by the patients, where they seek benefit of the explant immediately right after, maybe a couple of months after, but certainly all of them reap the benefits of the explant.
Very quickly before we take a break here, Dr. Khan, it sounds to me like a lot of times women are not taken seriously when they go to their doctors and express themselves about this problem.
That is a very good question. That is true. Now, if you ask me about cardiology, I'm going to tell you I have no idea. I'm not a cardiologist. If you ask me about GI problems, I'm not a GI gastroenterologist. Now, if you ask the primary care doctors, what do you know about breast implant illness? They're going to be like, what are you talking about? Implants are safe. They've been reintroduced. They're the gummy bear. They're nice, cohesive breast implants. They have not possibly even touched an implant in their life. And for them to offer a clinical opinion, sometimes it is premature and incomplete. And this is where the patients, as you will see, themselves are overriding their primary care doctors. They're overriding their plastic surgeons and now taking the matter in their own hand. And you will hear them directly, subjectively, declaring freedom from the silicone toxicity because they themselves made that executive decision about proceeding with an explant despite having the world tell them no, including their family members.
We are talking to Dr. Shaher Khan of Executive Plastic Surgery in Bloomfield Hills, talking about breast implant illness and what it means to many, many women in this country. Stay with us. We'll be right back. We're back. I'm Marie Osborne with Dr. Shaher Khan of Executive Plastic Surgery in Bloomfield Hills, a world-renowned expert in the area of breast implant illness. Let's just take 1 minute and discuss that part. The world-renowned expert in this area. This is not just something you say. There are literally women coming from every corner of this country as well as the globe to talk with you about their implants and to have them taken out.
Yes, I am honored and privileged to offer the service to the many patients that come to me from all over. What's interesting is I never did any implants. I only augmented once in order to get board certified because I knew the harm that the implants cause. And when I started seeing and doing all other aspects of plastic surgery, some of my patients came to me and they wanted a replacement, and I told them only an explant. And then I started doing it, and the next thing you know, one of my patients from Arizona, she formed this Facebook group page, and now we have well over 13,000 members. And now it is essentially feeding itself, if you will. The ladies, the sisterhood is connecting not only in the U.S., but North America, South America, Europe, Middle East. I'm blessed to say I've had patients from all of the states of the United States, from Canada, from Mexico, Panama, from the Dominican, from Egypt, from Qatar, I have a patient tomorrow morning coming in from Bangkok, patient I saw on this Friday 2 days ago from Austria, another lady from Switzerland, patients from England, many patients from England, Germany, Japan, and the list goes on and on, from Iran earlier this year, Italy. And so I'm blessed to have taken care of these patients. And the thought here is very defined. It's a philosophy, it's a mentality, and it is giving back to the patient. So the only aspect and the one and only goal of the whole practice is patient first. There is no other vested interest, no extra unnecessary surgeries, no lift operations, especially when the patients don't need them. We're offering 100% genuine, quality, sincere care so that when the patient gets done, myself and my team, they have given 110%, and the patient feels that they were like the president of the U.S. and they got the best care they could possibly get, and 100% focus and attention to detail. When the patients come to me and you hear them yourself, they are hurting. These are young moms, young ladies, like the lady today, 31 from New York. The many ladies, the 81-year-old lady that was involved with a car accident with the ruptured free-floating silicone on the right chest. So all the patients in the middle who are hurting, and they genuinely need this care because they are feeling the hurt. And as you will see, every patient is someone who has a significant other, they have kids, they are real people, they have feelings just like you and I, and they are suffering. And this is the same hurt and suffering that they live with every single day. Many ladies, believe it or not, have so much joint pain they're not able to function or do athletic sports, let alone live a quality of life. And this is what we're trying to address and correct. And this is where it's 100% for the patient.
Let's talk a little bit about some specifics when it comes to breast implant illness. What is capsular contracture?
So anytime you have any foreign body in the human, you will see a capsule is going to form around it. If you have a joint, let's say a replacement, you have that metal, you will form a capsule around it. In this case, you have the implant, and now the body recognizes this as foreign, and it is, as I mentioned earlier in the last segment, it is leaching out silicone particles, be it from an intact saline implant where the shell of that saline implant is leaching out particles, and the body is reacting to that silicone implant, and certainly a ruptured implant. And now the body forms this capsule. Now, sometimes, majority of the times, the capsule is relatively thin. In 8 to 10%, 13%, depending on the studies you read, you will see the capsule gets very hard and encases and compresses, contracts. That's where the word capsular contracture around. So if a patient has hardness, firmness, to the point where it contracts and lifts up into the chest and pain, that is the grade 4 capsular contracture, the highest of its kind. Grade 3 is essentially the same, where you have a distorted chest plus hardened breast tissue, but it's not painful. So that's grade 3. And grade 2 is where the breast to chest implant has hardened and it's not soft. And 1 is what would be defined as normal. And this does occur. You would think that on one side there is capsular contracture, grade 4, and on the other is grade 1. Why did it happen? Majority of the times we do not know. There are theories that suggest that there might be a biofilm of bacteria or reactionary tissue. It's been shown that if the implant is larger, there is a higher propensity for that to happen. If the implant is above the muscle, higher the chance for a capsular contracture to happen. And so but majority of the times we truly do not understand why it happens.
Just listening to you talk about the capsular contracture, and that previously we talked about that constellation of symptoms that women present with breast implants. This is part of the reason why these have been banned before. Can you talk a little bit about what led to the ban on these implants, and why was it lifted in your mind?
So the ban occurred because the ladies were hurting. You saw them get on the Oprah Winfrey show and on TV back then, where there was no social media. The doctors started to recognize this is a real entity, and they knew that indeed the implant was causing the hurt. And so clearly the FDA stepped up and took that authoritative measure to basically ban them so that they could look into as to why. Now, in 2007, they were reintroduced into the market as cohesive, meaning hard gel. You could take a needle or a knife and cut right into it, and just like the gummy bear, it doesn't leach or bleed. You would have that consistency, and that was a very nice selling term, i.e. gummy bear safe. And that is true. But what happens over time, and you see this on my Facebook Lives and the YouTube Lives, right in the operating room, as I remove that capsule, you seal them with the molten silicone, literally pouring out like honey, slime, if you will, and causing the hurt that the same set of implants before in 1992 and the 80s caused. So essentially, it's, yes, a newer technology, but ultimately the result is the same because the implant does melt, and you see it. You will see it's not the gummy bear anymore. It's not cohesive anymore. And if you cut through that capsule, you will see it will literally melt out just like lava into the periphery. And this is where not only do you see the capsule trying to contain this badness, but you see the MRI showing silicone within the lymph nodes. So it's migrating into the periphery, into the neighboring tissues. And we have clearly reports of histology done of lung tissue itself, where via the bloodstream, the silicone did migrate into the different other body parts.
Very serious consideration, something to really think about if you're considering breast implants, certainly. We're talking to Dr. Shaher Khan, Executive Plastic Surgery in Bloomfield Hills, a world-renowned expert in the area of breast implant illness. Can you talk a little bit about dense breasts, breast implant illness, and dense breasts?
So dense breasts are basically a genetic presentation of a patient who may have just very thick, dense breast tissue. As one is younger and in their teenage years and 20s, you will see the breast tissue is relatively much more dense than in the 30s, 40s, especially post-menopause, where the breast tissue starts becoming atrophying and it becomes more fatty and less glandular in nature. So this is a density of the breast tissue upon palpation, and especially when someone is young and usually genetically predisposed. But this is the inherent quality of the breast tissue as one is of younger age.
And this can happen, though, the breast implant illness, as you've pointed out several times now during our interview, that this can happen to anyone at any age. So you're talking about 25-year-olds and 80-year-olds. This can run the gamut.
Yes, absolutely. So there are patients that have reacted to the implants within days of getting them, and they got an explant day 29 with me. And these are patients who have had them 40 years and they decide to remove them. So there are a whole subset of patients because they didn't know any better.
We are talking again to Dr. Shaher Khan, Executive Plastic Surgery, here on WJR. When we come back, more about breast implant illness.
You're listening to a special edition of Spotlight, Executive Plastic Surgery with Dr. Khan. Once again, here's your host, Marie Osborne.
And we are back with Dr. Shaher Khan, Executive Plastic Surgery. I'm Marie Osborne, talking about breast implant illness. Dr. Khan, can you talk a little more about these silent ruptures? You said yourself that you've had women present here who wanted to have their breast implants out. They just wanted them out. And sure enough, you go and you find out that they had a rupture in their breast implant.
So I have taken care of a lot of ladies that came with a normal physical exam, or they said, I'm at the 12-year mark. I've heard they're not lifetime devices. I need to get them replaced or removed. And I only offer removal. I do not offer replacement. And when I go in, to my surprise and to the patient's surprise, she has a rupture on the right. And it happens literally every week. I go in and the patient has what is a silent rupture, meaning on the exam, you cannot tell if the patient has a rupture or not. And the only and the best study that is out there is an MRI without contrast. There is no radiation. There is no contrast. And that is a very high pickup rate for what is a rupture. And now let's go ahead and go back and look at the manufacturers. And again, what I have said today is I'm highlighting the obvious. I'm just being, I guess, too honest. But this is what the manufacturers themselves are saying. And so I'm looking at the Mentor advertisement. Quote, the health consequences of a ruptured silicone gel breast implant have not been well or fully established, period. MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture, period. So close quotes. Now, this is what they're telling you. If you get an implant, silicone implant, and you are going to do surveillance, you have to get the MRI at year 3, and then every 2 years they're onward. So let's say if someone has implants for 9 years, you're going to get one at 3, at 5, so that's 2, 7, and 9. So you're going to have had 4 MRIs. And who's going to pay for it? The patient. The insurance is not going to cover because this is all cosmetic. So now they have done, well, we told you need to get screening. And realistically, you know, this has been studied by the American College of Surgeons. Less than 5% of the patients do this. And you can see no one's going to leave their busy schedule and get these MRIs. So this is the silent rupture we're talking about. This is where a lot of ladies who are walking about on a daily basis, who have ruptured implants, and they do not know it. And this is where, now remember, I'm not recommending an MRI. These are the manufacturers, right? And so this is where you have to do the silent rupture. Now, what's ironic about the thing here is they say they're not, the health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Now, I'll tell you, it's not healthy and normal to have a ruptured silicone inside the body, period. So you have to, that's why they're telling you to get the MRI. That's why they're asking you to remove it. And this is where the technique comes in, where you have to remove the implant plus the capsule such that none of that silicone spills into the chest, none of that slime, if you will, spills into the chest, and it's all contained. Because once it spills into the chest, the silicone will then continue to impart the toxicity, the silicone mastitis, granuloma amongst the hurt, because it is a foreign substance, and then it is going to hurt the body. Sometimes acute and chronic pain, like the lady that came from Switzerland, she had residual capsules that were left behind, and now she was feeling the hurt from that silicone that was left behind within the capsular tissue. And the point here is that all of that ruptured silicone needs to be removed in a very defined, contained, systematic way such that none of that silicone slime spills into the chest.
Can we talk a little bit about the specimens that you sent to pathology and microbiology?
Yes, so I can actually help understand this, where this is part of the Kahn procedure, where I myself said anytime any capsule that is removed, which is the whole goal of the surgery. Remember, anyone can remove implants, but the whole implant capsule needs to be removed in that defined way, as I mentioned earlier, where the entire capsular tissue needs to be removed off of the rib. And then when it is completely removed, it must be sent to pathology to rule out the very rare of rare BIA ALCL, which is the breast implant associated anaplastic large cell lymphoma. Also, the FDA reported a couple of years ago the BIA breast implant associated SCC, squamous cell cancer, and anything abnormal, breast cancer. Today, this morning, I saw the patient who lives an hour away. She had a fibroadenoma that I removed from her chest because I was dissecting and I ran into an abnormal mass and I removed it. So anytime it's removed from the human body, especially in and around the breast tissue, it has to be sent to pathology to rule out the lymphoma, which is very rare of rare. To date, only 1,233 cases have been reported all over the world. But as you will see, not every surgeon is removing the capsule. Even if they're removing the capsule, they're not sending it to pathology. Even if they're sending it to pathology, they're not doing the CD30 stain. And now this lymphoma, as the Society of Plastic Surgeons and the plastic surgeons and the doctors and the manufacturers will report, it is very much underreported because no one is sending this off to pathology.
So that's a very important thing to remember about having your implants out, that you have the pathology done correctly.
Correct. Very important. So you have the peace of mind. There are going to be no surprises. There was a case report of a patient who had an explant. The capsule was left behind. 4 years later, she ended up getting lymphoma. Now, this is where she should have had the capsule removed completely. So now there is no doubt in her mind that all of the capsule was removed and it was tested. Again, a very important point I want to highlight and specifically mention that the entire capsule must be completely, sincerely, definitively removed, because if it's not, you will not recover fully. We know this from the many patients who had implants removed along with partial capsules or no capsules. They did not improve fully, and only then, when the surgeon removed the residual capsule, only then did the patient benefit from complete residual capsulectomy and improvement in her many signs symptoms of what is breast implant illness.
We are talking to Dr. Shaher Khan of Executive Plastic Surgery, and when we say world-renowned, we mean it. His patients come from all over the world and every corner of the United States to talk with him about breast implant illness. He is a specialist in this area. Dr. Khan, what are the goals of surgery?
So the goals of the surgery are, number one, to remove all of that inflamed tissue completely, sincerely, definitively, and the capsule, especially on top of the rib, such that the entire capsule is removed, including the inflamed tissue around. So it's not necessarily the capsule per se, but the inflamed tissue around. That's fat, necrosis, whatever tissue that's abnormal. And that when it is removed, it is sent to pathology and to rule out the BALCL, as we mentioned earlier, malignancy. Remember, it's very rare, but it must be tested. The other thing is I send cultures off for aerobic, anaerobic, and fungal to make sure there is none as far as bacterial colonization, which does occur 10-15% of the time in my practice because of the inherent because of the implant that's in the proximity to the skin. Number three, what I do is I do what is twilight sedation, which means I do not put the patients under general anesthesia. The patients have completely amnestic to the whole surgery. I return the implants to the patient so that the patients have a mental closure, psychological closure as to what was inside their body and it was completely removed in the manner that we talked about, especially the saline implants and certainly the ruptured silicone implants. Number five, this is not the time to be doing a fancy lift, even though I've offered a lift to the patients. I'm able to remove that excess skin horizontal only from the crease along with the internal sutures that I put. That gives the patient a pseudo lift, if you will, and with the fluffing effect and the 5, 10, 15% of the muscle mass they will add to your chest when they start working out, you will see there is no need or indication for what is a very exaggerated, unnecessary lift operation. I also do not do drains. The last time I used drains was well over 5 years ago, even in the many ruptured implants, 800cc implants that I've done. And no matter what the age or the comorbidities that the patient has, I offer the same surgery to the patients. I do not compromise the surgery because of the age of the patient or the size of the implant. Every patient gets the same surgery so they get the same recovery. And this is outpatient surgery, very well tolerated. And this is the only surgery that I do. I remove saline implants, silicone implants, and residual capsules from the many patients that come to me from far away.
And again, we want to stress that there's no age off limit here. If you have an implant and you're concerned about it, Dr. Khan can talk to you about that. You've had young women as well, all the way through women into their 80s have this type of surgery. So I'm curious what brought you to this kind of work as we close out the show. Tell us a little bit about why you chose this specialty.
So I initially measured in biochemistry. So we looked at metals, we looked at mass spectroscopy, NMR, nuclear magnetic resonance imaging, and the world of parts per million, parts per billion, that we do as biochemists. So I saw in my training when I was in medical school and when I was in training at Yale, I saw the patients themselves come with the ruptured implants, and these are the patients that were hurting. And I said, I don't want to do this as far as my practice. My goal is do no harm, do nothing that will eventually end up hurting the patient. And as you will see, if you just listen to this speech, and remember, all what I have said today is not my opinion. These are hard facts from the FDA, from the manufacturers, and most importantly from the patients who have only said two things. They wish they had never gotten the implants, and they wish they had explanted sooner. I did not want to hurt the patients, and I'm truly at times intrigued by the fact that what a procedure I chose not to do, my specialty has come down to removing what I chose not to do, and I'm blessed and honored to help the many patients and hopefully the purpose today is to have the patients not make a decision, but to get that informed consent. So if they're hurting, they know they have the relief that awaits them.
We've been talking to Dr. Shaher Khan of Executive Plastic Surgery. Again, you can find him on YouTube, Facebook, TikTok videos, and of course, right here on WJR. Dr. Khan, thank you so much for joining us today.
You're welcome. It's been an absolute pleasure. Thank you.